Oxygen therapy is a cornerstone of modern medicine. It involves supplementing the body with additional oxygen. This is crucial for individuals who struggle to obtain sufficient oxygen naturally. Oxygen therapy can be life-saving. It is used in various healthcare settings, from hospitals to homes. Oxygen therapy is incredibly versatile. It can be administered for short periods during emergencies. It can also be used long-term to manage chronic conditions. The goal is always the same: to ensure the body receives an adequate oxygen supply. This is essential for survival and overall well-being. Oxygen therapy is a relatively simple concept. However, it requires careful administration and monitoring by healthcare professionals. This ensures patient safety and the therapy's effectiveness. The field of oxygen therapy is constantly evolving. New technologies and approaches emerge to improve patient care. Oxygen is the breath of life, literally. Every cell in our body needs oxygen to function. Without it, cells would quickly die. This process is known as cellular respiration. During this process, cells use oxygen to convert glucose or sugar into energy. This energy powers all bodily functions. Think of oxygen as the fuel that keeps our cellular engines running. It's essential for everything from breathing and digestion to movement and thinking. When we breathe in, oxygen enters our lungs and is absorbed into the bloodstream. The heart then pumps this oxygen-rich blood throughout the body. Without sufficient oxygen, our cells cannot produce the energy they need. This leads to a cascade of problems, from fatigue and shortness of breath to organ damage and eventually death. This is why oxygen therapy is so crucial. It provides a lifeline for those whose bodies cannot obtain enough oxygen on their own. Oxygen therapy encompasses different approaches to meet individual needs. Continuous oxygen therapy, as the name suggests, provides a constant flow of oxygen. This is typically prescribed for individuals with severe respiratory conditions who require supplemental oxygen around the clock. Intermittent oxygen therapy, on the other hand, is used on an as-needed basis. This approach is suitable for individuals who experience episodic drops in oxygen levels, such as during physical activity or sleep. Hyperbaric oxygen therapy is a more specialized form of treatment. It involves breathing pure oxygen in a pressurized chamber. This increases the amount of oxygen dissolved in the blood, promoting healing and fighting certain infections. Each type of oxygen therapy has its own set of indications, benefits, and potential risks. The choice of which type to use depends on several factors, including the underlying condition, severity of oxygen deprivation, and individual patient needs. Delivering supplemental oxygen effectively relies on a variety of systems, each tailored to specific situations and patient comfort. Nasal cannulas are perhaps the most common. These consist of two small prongs that fit into the nostrils, delivering oxygen directly to the nasal passages. They are comfortable for long-term use and allow patients to eat and speak freely. Oxygen masks, covering both the nose and mouth, deliver higher oxygen concentrations. They are used in situations requiring more intensive oxygen supplementation. Portable oxygen concentrators have revolutionized oxygen therapy by providing patients with mobility and independence. These devices extract oxygen from the air, concentrating it for the user. This eliminates the need for bulky oxygen tanks, allowing patients to stay active and engaged in their daily lives. Section 5. Conditions treated with oxygen therapy. Oxygen therapy plays a vital role in managing a wide range of medical conditions, primarily those affecting the respiratory system. Chronic obstructive pulmonary disease, or COPD, a progressive lung disease that makes breathing difficult, often necessitates long-term oxygen therapy to alleviate shortness of breath and improve quality of life. Pneumonia, an infection of the lungs, can severely impair oxygen absorption. Oxygen therapy helps maintain adequate blood oxygen levels until the infection resolves. Asthma, characterized by airway inflammation and constriction, can also benefit from oxygen therapy during acute attacks. Carbon monoxide poisoning, a life-threatening condition, occurs when carbon monoxide displaces oxygen in the bloodstream. Hyperbaric oxygen therapy is often used to treat this condition, rapidly clearing carbon monoxide from the body. Section 6. Risks, monitoring, and patient safety. While oxygen therapy is generally safe, it's essential to be aware of potential risks and the importance of careful monitoring. Oxygen supports combustion. Therefore, open flames and smoking are strictly prohibited near oxygen therapy. Oxygen toxicity is a rare but serious complication that can occur with prolonged exposure to high oxygen concentrations. Regular monitoring of oxygen saturation using a pulse oximeter is crucial to ensure the therapy's effectiveness and adjust oxygen flow as needed. Healthcare professionals play a vital role in educating patients about potential risks, ensuring proper equipment use, and closely monitoring for any adverse effects. Patient education is paramount in ensuring safe and effective oxygen therapy. Understanding the proper use of equipment, recognizing potential hazards, and adhering to safety guidelines are essential for optimal outcomes. Section 7. Advancements and innovations in oxygen therapy. The field of oxygen therapy continues to evolve, driven by technological advancements and a focus on improving patient care. New generation portable oxygen concentrators are becoming increasingly lightweight and energy efficient, further enhancing patient mobility and independence. Smart oxygen delivery systems use sensors to monitor breathing patterns and adjust oxygen flow accordingly, ensuring optimal delivery while minimizing waste. Researchers are exploring the potential of liquid oxygen therapy, which offers higher storage capacity and longer-lasting portability compared to traditional oxygen tanks. Innovations in oxygen delivery devices, such as high-flow nasal cannulas, provide increased comfort and efficacy for patients requiring higher oxygen concentrations. These advancements aim to enhance patient comfort, improve treatment outcomes, and provide greater flexibility and convenience for individuals relying on oxygen therapy. Section 8. The vital role of healthcare professionals. Healthcare professionals play a pivotal role in every aspect of oxygen therapy, from initial assessment and prescription to ongoing monitoring and patient education. Respiratory therapists are crucial in evaluating patients for oxygen therapy, recommending appropriate delivery systems, and ensuring optimal device settings. Nurses provide ongoing care, monitor patients' responses to therapy, and educate patients and their families about oxygen therapy management. Physicians oversee the overall treatment plan, adjust oxygen prescriptions as needed, and address any complications or concerns. Effective communication among healthcare providers is essential to ensure seamless and coordinated care for patients receiving oxygen therapy. Section 9. Conclusion. Oxygen therapy, a life-saving intervention. Oxygen therapy is a cornerstone of modern medicine. It provides a lifeline for individuals struggling to obtain sufficient oxygen. From its essential role in cellular function to the diverse types of therapy and delivery systems, oxygen therapy has revolutionized the management of respiratory and other conditions. The continuous evolution of oxygen therapy, marked by technological advancements and a patient-centered approach, promises to further enhance its effectiveness and improve the lives of countless individuals worldwide. As we gain a deeper understanding of oxygen's vital role in health and disease, we can expect to witness even more innovative applications of oxygen therapy in the years to come.